And so what I will say related to DPSCD, we are online, as you know, currently, but we will be returning on Monday, January 31st. All staff, all students, everyone will be returning in person on Monday, January 31st. And that decision was made because we do see the COVID positivity rate in the city going down. So back in December, Detroit's positivity rate was about 40%. We also knew from staff that was testing the week of December 27th, we had staff testing voluntarily. They were coming in at a positivity rate of 21%. So in December, we knew we had about 800 staff with COVID in the district. And that meant at that time, the isolation guidelines and the quarantine guidelines were, 10 days out. And so you're looking at staff shortages, and you're also looking at COVID in the community being at a very high rate. So in conversations with the Detroit Health Department at that time, basically what was explained to us is that there's a forest fire in the community in terms of COVID. And anyone that has ever seen a forest fire or has watched news coverage knows that you take a burning log from one forest fire and then you have another forest fire happening because that log has come into a new forest, right? And one of the ways that we prevent spread is by digging a trench. And so the health department advised us, so we had long conversations, that in order to stop that spread, to stop that jump, we needed to build a trench. And so we have built that trench. We have seen the numbers going down, both in our schools for folks who are in person. We do have a weekly testing protocol. So we have a very robust dashboard where we can see everyone who's tested and their results. We now see this last week, our positivity rate among the district staff that was testing was about 2.5%. That's down from 21% in December. And so we feel confident now at this point that we can return safely. In addition to the city rates going down, we're seeing, of course, our own data showing that the numbers are going down. But that, in addition to masks, social distancing, temperature check, symptom check, contact tracing, weekly testing. So it's all of these things together.
Rajeshri, you are working with another complex environment too. Not only the complexities and challenges of COVID, but the fact that Detroit has a very fragmented, quite frankly, charter system. While we have some great schools, it's hard for our parents to navigate it. So we are grateful to have you with us to help try to give some sense of where our charters are, who are also navigating these complexities. Can you tell us about what does it look like about return to school versus virtual amongst charters throughout the city?
Sure, absolutely. Thanks for having me on for this very important topic. I think, like Dr. Meriweather talked about, similar strategies, looking at what is happening in the community, and because charters are sort of scattered throughout the city and have students from throughout the city, that I think they focused in on the communities that they serve, and then also just sort of what can be done. And so we've had, I think, a mix. We've got some schools that have chosen to remain remote for until next week, and we also have a number of schools that did feel as though they could institute the right kind of safety protocols and put in place programs that would keep kids and teachers safe, and those schools have been operating since we got back in January. The thing about charters is that our schools are smaller and we're independently governed, so there is a group of people, specific group of people for each school making the decision, which allows them to really look at the individual school, the school community, and kind of what the needs are. And so there's a little bit more flexibility and nimbleness than maybe DPSCD is afforded, simply because they are a much larger institution, kind of having to govern a much larger group. So that's, I think, that's the way we've done it. I think the decisions have been a collaboration between school boards, school leadership, parents, and community. And we have seen parent input at a number of our board meetings, kind of supporting and giving their feedback. So, but I do think that all of the schools that have gone back have reported that things are operating smoothly. Yes, there have been cases here and there, but we haven't had huge wide outbreaks. We haven't had huge wide teacher shortages. And so I think they've done a very good job of mitigating the risk and doing, and allowing the schools, the students to come back.
Could you, or do you have a sense for how many of the charters are now remaining in school or either returning back to in person?
Sure. So statewide, I can tell you the majority of charters remained in person. And the only places that we saw schools that did not reopen was in the Detroit area, which makes sense given the numbers across the state. In the Detroit area, again, I would say more than half reopened. And then there was, but then there are a certain number of schools that decided not to. And what I see with those is, again, those are some of our larger networks that I think similarly to the decision making have to make a decision for a wider swath of a community. If you have 10 schools or 7 schools or something, you're looking at a much wider group of folks. And so the decision making is slightly different. I think you keyed in on it there. So, but I'd say more than half, probably 70%, I'd say are open, and then the rest, and that really is limited to some of our larger districts that within the charter system that have decided to reopen either this week or next week.
Right now, for consents, we are at 91% of our students consenting. And basically, when we come back on the 31st, we have said to families, if you're going to be in person, you need to have a consent on file. And so what we're looking to see is that every single student and every single adult that's in our building is testing every week. And so that is our plan moving forward. We'll continue to work with families to get those consents in, but we're currently at 91% of our families have consented.
You can find more at onedetroitpbs.org or subscribe to our social media channels and sign up for our One Detroit newsletter.